Hey everybody, this is Eric with Motion Guidance, and thank you for joining me today for the Healthy at Home series. The topic today is going to be around the foot and the ankle, and a couple options that you can use with our patient pack that you can find on motionguidance.com. As always, we recommend you consult a qualified healthcare professional before starting activity using our device. However, things like an ankle sprain, chronic ankle pain, foot type of pain, pain around the knee or below, maybe peripheral artery disease, peripheral neuropathy, all of these might be addressed by utilizing these suggestions. So let's get started. So if you order a patient pack for the foot and ankle area, you're going to get this flag that comes with the pack. You're going to get a small strap, a single flat mount, and a battery-powered red laser along with the carrying tote that all comes together in that pack. So to get started on the exercises, we have a few options for you today. You're going to hang your flag on the wall, and we're going to take this small strap and we're just going to put this around the middle part of my foot that I want to work on today. Okay, and this is just Velcroed on. You have a blue field right here on this belt. You can take the flat mount that comes with the kit, and you can just slide that right on there. Into that field, and then attach the laser by just tilting it to the side, gently popping it on, and then tilting it up. So what we can start with here is putting the heel on the ground, and let's just work on what we might call cardinal plane motions, which is going to be up and down and side to side. So I can reach down and turn on my laser, and I can just position that laser toward the center of the target. Now from here, if I point my toe down toward the ground, I'll be acquiring motion, flattening out my foot, which we'll refer to as plantar flexion. And if I bring the laser high up on that center line, I'll get dorsiflexion. Okay? So I can move up and down throughout the range, on the flag or even going off the flag, trying to stay on the center line the whole time. You might notice that if you drift off, you might have to come back in the middle, okay? For this first exercise, it's moving up and down. Now, if you feel like you can go way far down, off the flag in one direction, but not as far the other direction, you can always change the starting point on the laser, and you'll be able to work higher or lower through that range, utilizing the flag as motivation to increase your range of motion. So that's dorsiflexion and plantar flexion. Now if we want to work on the other straight plane, we can work toward the right or the left of the center target. In physical therapy, we refer to this as eversion if I'm on the right foot, and inversion here, okay? Same idea, working on increasing your range of motion as tolerated over time, and precision by staying on the line for this particular exercise. All right. Then we can progress to more complex motions. So we can utilize what some people refer to as the flower design on this particular flag. And we can start in the middle and work on creating or tracing this particular pattern in all four fields. Okay, that was the inner black target. We can go toward the outer flower design. And work our way around the flag. You can perform these until the ankle starts getting fatigued or tired, or you can just do groups of 10 for now. Okay? Now if we were to move on from this and make this even more difficult, I could hold the leg up and do the same thing with it hovered above the ground. Now this is definitely more challenging and potentially can get you even more range of motion at the ankle and really work on gaining control. Okay. We can also utilize the other targets to work on precision and what might be referred to as motor mapping and prediction by getting into different areas on the flag while the leg is being held up. If you really want a challenge, you could also do these in the standing position, which would incorporate balance on the opposite side.